getting ready for the salt therapy. I'm gonna put on my little booties. It's like going into where they deliver babies. Alright. This is the halo chamber. And this is the walls are lined with salt, which the patients breathe in. It's getting full.
Oh wow.
Is the lighting
Yeah.
Well, salt therapy, what it is, it's basically mimicking the salt caves over in the 1800s from Europe. So nowadays you can go to Europe and you can actually go into real salt caves and experience salt therapy in the real caves actually. But what it does is basically for those 45 minutes that you're in there, you are just breathing in the salt, which is antibacterial and anti-inflammatory. So it's going into your sinus cavities, relieving a lot of congestion. It's great just as an immune booster. If you don't have anything, it helps relieve any sort of symptoms if you're coming up with a cold or if you're going to get sick. It helps with allergies, cystic fibrosis. So it has, salt itself, it has a lot of benefits.
Wow. Interesting.
Halo, is it halo therapy or hollow?
Is it hollow?
Is it hollow or halo? Hollow therapy.
Or salt therapy.
Salt therapy.
What it's become known.
That is the hollow generator, right?
It's right here.
Oh, that's the hollow
This is
generator.
what pulverizes the salt.
This is the generator?
Okay.
That's just our UV light to sterilize the room in between sessions.
Oh, okay. So this is the hollow generator. This is the hollow generator.
Yep.
Just finished my first session.
How do you feel?
It was interesting. After the first 10 minutes into it, I started feeling like a tickle in the back of my throat. But nothing crazy, nothing.
How long is the session?
It's an hour session. Very relaxing. Almost fell asleep.
I'm Marinette Hoppus, and I'm the director of the Salt
Can
Room.
you tell us what is salt therapy?
Salt therapy is an all-natural therapy that uses dry aerosol salt to relieve symptoms of respiratory conditions and skin conditions such as allergies and asthma. It is a natural, salt is a natural antihistamine expectorant. It relieves inflammation and helps mucus gets dislodged, so that's why people can breathe better when they do salt therapy.
What are some advantages of salt therapy compared to medicine?
Well, salt therapy can work hand in hand with the medicine. This is not something you have to stop your medication to do. On the contrary, if you have an infection and you're in antibiotics, then this will help dislodge the mucus, not kill the bacteria like the antibiotics do. So it actually works hand in hand. There's no side effects for it. And a lot of people are out there looking for something natural without side effects, and that's what this gives them, provides.
For those people that say that like eating salt is not good for you, what would you say? What would you tell them about taking it into their lungs?
Yeah, it's a completely different situation. Eating sodium chloride has been proven to be not good for you, but inhaling it just acts as a natural expectorant. It's a mineral that helps your lungs and your sinuses, work better. Your body has salt in it, and if you don't have the right combination, the right amount, then other things can occur. So this you need some salt in your body, and this definitely helps.
Okay. Where do you see the future of salt therapy heading?
Oh my gosh, when we opened this salt room, we were the second one in the US, and there's tons of salt rooms that have opened in 2 years. So we are right now at the salt room here in Orlando undergoing the first clinical research done in the US for cystic fibrosis. We have a medical advisor, a local pulmonologist, Dr. Daniel Leyesh, who's heading that up. So in the next few months, we're going to have some concrete results for what salt therapy can do for CF clients. And that's just going to be the beginning. We're going to have salt rooms everywhere. So basically, for respiratory therapy, I don't know what it will become, but I can see salt rooms in hospitals, and salt rooms in treatment facilities, even in private doctors' offices, to get the treatment to patients that need it. The healthcare system in America is so different, it's so medical oriented, Western medicine, and there's room for that. But I think with this research that we're doing, we're setting the baseline for this could help together with with the Western medicine.
Right.
And that's what people want. People want alternatives, different things that could help. That are going to help them. It's good. I think it's going to take time, you know,
Right.
but I think it's here to stay. So it's just a matter of places like ours doing this for the medical facilities so that we can write it and put it in. This is not the place to come when you're having an asthma attack. I mean, if you're having an asthma attack, albuterol is what you need
Right.
to do. But this is something that you can integrate in your life so that you don't get to the asthma attacks.
Right.
So that you can manage your life in a way that prevents you from having all those flare-ups and having to use the inhaler day to day. And that's what our clients want. They know that they have COPD, and that's for life. They just don't want to depend on those drugs all the time. They don't want to have an oxygen tank attached to them all the time. They
Right.
want to be able to play golf. And you'll be amazed how many elderly people we have that have COPD and emphysema and cystic fibrosis, and they come 3 times a week because they feel so much better day to day, and they still have medications, and they still, get their bouts of bronchitis and have to go on antibiotics, but this has helped them live day to day
Right.
better. So you'll be surprised how many people out there are open.
Right.
We have a lot of men that come on their own, which, men don't really like to go to the doctor,
Right.
they don't,
Absolutely.
even my husband is like, oh, everything, I'm fine, I'm fine, and they don't, and then their wife says, go to the Salt Room, and they're like, well, my wife said I should come here, and then they come and they do 5 sessions, and they feel better, and they love it.
So it's usually after the 5th that you start really getting.
3 to 4. I mean, the big change happens between 3 to 4. I say 5, we sell a 5-pack, and that's
Right.
a popular place to start because that's when you'll see big changes happening.
Okay.
So yeah, I mean, it's here to stay. There's a place for it. With our medical advisor and with the research we're doing, I think it's just the beginning of we're opening other salt rooms. We're opening a salt room in the Bahamas this month, and by next month we're opening a salt room in the Villages, and those are our brand, the Salt Room. I
Okay.
mean, they're all different companies out there. But our brand, and we wanted our brand to be what this is. We wanted it to be mainstream America. It's not weird and new agey. It's not a doctor's office.
Right.
It's just a very clean wellness experience for people.
Right.
We have babies and grandmas that are 90 years old that come here, and like I said, men and women of all ages. So I think what we have done, we have captured that what Americans like in a place like this, and we're replicating it. So I think there's nothing but up to go.
There really isn't. I appreciate that, but this
Yeah.
very, very nice experience, very relaxing.
Good. I'm going to give you some brochures for you to take back. I'm sure you have colleagues and other
Definitely.
students that are interested.
I'm actually gonna be showing this to like 60 people.
Yeah,
So,
well, we'd love to show it off. So whoever is interested in coming just to check it out, or because they need to, I
Right.
mean, we're here. Word of mouth has been amazing to us. There's no advertising that pays as much as just people experiencing it.